Hello, I am Dr. Margo Pumar. I'm a psychiatrist at the Department of Psychiatry for the University of California at San Francisco. And today we're going to be talking about interpersonal violence during the COVID-19 pandemic, and especially how to use telehealth to provide universal education for IPV. We know that intimate partner violence is one of the most common forms of abuse against women. And it constitutes not only physical and sexual violence, but also emotional, verbal, and many other forms of controlling behaviors. Now, during any crisis, we expect that IPV would be on the rise. However, this is especially true with shelter in place, where survivors are forced to stay in home with those that might harm them, and children are losing schools as their place of safety. Therefore, we need to know how to help our women while not causing additional harm. Many IPV survivors describe having no access to digital or other privacy. So during telehealth or phone visits, we can't know who's listening or checking voicemails or call logs. Patients will tell us that they cannot always ensure their privacy with the patient portal, as someone may force them to give the password. Since the same is true for emails, we advise survivors to set up a new email account with easily remembered passwords. Texts also can be read by anyone and used to get information like patient appointment times. So universal education is the best practice. It's the safest way to get information to your patients without causing harm. So we don't always know when our patients have this, but we know that in general about women do. And women don't disclose for many reasons. In addition to shame, lack of means to leave, fear for economic issues, retaliation, concern for their children, and many other issues. So universal education allows us to provide life-saving information without requiring any disclosure. So what I often do is provide a little bit of universal COVID-19 education followed by universal education for IPV. And it's important to always make it clear that you are providing this IPV to all patients. Here is an example of something you might want to say. During this COVID-19 pandemic, we are counseling all patients about how stress can affect relationships by increasing arguments or physical harm. There is help available, and we offer patients a hotline to share with any family or friends in need. May I give you this hotline number? And then we offer the number. I like to suggest something easy to remember, like 1-800-799-SAFE, which is the National Domestic Violence Hotline. Also, you can maybe create a phrase that can be added in the after-visit summary to make sure that you do provide this with all patients. But again, make sure the language includes that this is provided for all patients. This and many other information that I've provided for you is available at leapsf.org. And also, they have something online that includes a one-page educate and a screen and assist for IPV education, as well as how to encourage your patient to provide themselves with a safety plan. Here are some San Francisco-based community resources. Women's Inc., La Casa de las Madres. Shelters are often still open for women, although things like drop-in counseling centers may not be. Other important things: Cooperative Restraining Order Clinic, San Francisco's Women's Against Rape, Community Against Violence are some other really helpful resources to provide your patients. National resources include the hotline that I already mentioned. You can also text them. Love is 22522. There's also the National Sexual Assault Hotline, the Trans Hotline, and a Deaf Hotline for patients. Thank you so much for watching this video and taking time to think about how to safely provide care for your patients who are at risk for IPV, whether you know it or not. Thank you so much, and thank you for all you're doing during this time.